Hi guys, it's Cara the Bubblelush. So now I'm on to my 37-week pregnancy update. Thank you guys for being so patient over the past couple days while I upload these rapid fire. So the day before I turned 36 weeks, the baby finally flipped. And I wasn't sure if he was head up or head down, which seems kind of weird. It feels like you should be able to tell by the way he's kicking or where you're feeling hiccups or something, but I just wasn't sure. I thought maybe he also could have just like completely folded in half. Something happened to where he wasn't wide anymore in my uterus. He was some other way. So because I wanted to verify his position, I still had the ultrasound done. They also wanted to see how big he was because he was measuring really big at the growth ultrasound back in December, way back. And we kind of wanted to have an idea of just how big this baby was getting. Ever since he turned, I was making this joke with Chris that I was like, it feels like I have a 7-pound bowling ball in my pelvis. And I was like, and that's exactly where I want it to be, but like, whew, it went from 0 to 60. I had really kind of no weight on my pelvis to all of a sudden just, it just hurt. It was a kind of intense to all of a sudden have a baby putting that much weight on my pelvis, and so it was starting to get kind of a little unstable. It was really unstable with Hannah, and so I was trying to be careful. So let's say I always kind of envision like you're playing soccer, but if you put your foot out and you kick like sideways, like if you're like knocked a ball to the side, like that kind of a movement, that sweeping of the leg side to side is so bad for your pelvis, especially if you're trying to, even if you're just using your leg to like scoot something out of the way, having that resistance, that's what like kills my pelvis. And when I say pelvis, I'm talking about like the very front where your pubic bone is. It feels like it's almost like an internal pain. So it was something that I'm kind of sensitive to because I know how bad it got with Hannah. So I'm just kind of careful about the way I treat my pelvis. It's just something that I have to kind of keep in mind, and I think most chicks in a third trimester do, but I figured it was worth mentioning. I met with my chiropractor. I'd originally scheduled this appointment with my chiropractor to do the Webster technique in order to try to get the baby to turn. But since I thought the baby had turned, but I was still having some pain. First of all, my neck really needed to be adjusted. I was starting to get kind of some headaches. My back just kind of needed to be popped into alignment, but I could feel what are called your SI joints. Ooh, the baby is moving like crazy right now. Ooh. I could feel my SI joints, which are kind of like in your hip, butt, that kind of area. They were just really restricted. And it's the type of feeling like when you want to like twist your body and pop your hips and stuff. But for some reason I can't do that anymore. I used to be able to do it all the time. You could just lay on the floor and throw your leg over and like twist your whole back and pop it. Self-adjusting, as my chiropractor says. But anyway, so she checked it all out. Both of my SI joints were out. My neck was a total mess. And my back really needed to be popped into alignment. And as soon as I got out of that appointment, I felt 1,000,000 times better. We did do the Webster technique just to make sure that my ligaments and everything were supporting the baby and trying to encourage that good position. But it wasn't, I wasn't looking necessarily for like an immediate change, like all of a sudden the baby, you know, can turn, because he had already turned, hopefully head down. So that was on Tuesday, and then on Thursday morning I had my ultrasound appointment. So the ultrasound was at 8:30 in the morning, and they wanted me to go see my midwives afterwards, but they didn't have like necessarily an opening, so they scheduled me for an appointment at 11:40 just so I'd be on the books. And they said, as soon as you're done with your ultrasound, just come over and we'll squeeze you in. And I was like, okay, no problem. Thank goodness my parents have switched their vet from down where they live to my vet up here, because they're just better. Closer to the city, I don't know, it's just a better vet. And their dog needed to come up for an appointment to get some testing done and stuff. And so my dad came up the night before my ultrasound appointment to watch Hannah, to stay with her. And thank goodness he did, because my ultrasound appointment was at 8:30. I got out of it probably around 9:30. I went and sat in the waiting room for the midwives, and they weren't able to get me back until my appointment at 11:40, which really wasn't even an appointment. They thought that they were going to be able to squeeze me in, and they just couldn't. So I didn't get home until after 1, and I left the house at 7:30. So had Hannah been with me, she would have just been a total mess. Just a total mess by the end of that. So frustrated and bored, and I wouldn't have blamed her. So I'm really glad that she was able to stay with Papa, and they had a great time, and I was able to really concentrate on what the doctor was saying and what the midwives were saying, and kind of be present at my appointment instead of, you know, making sure Hannah's not spilling goldfish everywhere. Anyway, I get to the ultrasound appointment, I lay down on the table, and I, you know, pull my belly panel down and pull my shirt up, and I'm like, all right, let's do this. And she looked at me and she goes, "You're 28 weeks pregnant? Is there 2 babies in there?" And I was like, no, I'm 36 weeks pregnant. She was like, "Oh, I have the wrong record." So that was all messed up. So, but the look on her face was like, it was really funny. So we started doing the ultrasound, and she was like, she started way up here at the top of my tummy, top of my uterus, and she was like, "That is a butt. He is definitely head down." And I was like, woohoo! So, oh, thank goodness, because at my, I didn't talk about it, but at my 35, I guess, and a half week appointment, my midwife was like, "Okay, so if you're able to get the baby down to like turn, if you're able to get the baby to turn, but it's breech, how do you feel about like a breech vaginal birth?" And I hadn't even, that wasn't even on my radar at all. The idea of having a breech vaginal birth, oh my goodness, woo, that seems really scary to me. So we had talked about everything that would need to happen, like including an MRI with measurements and another really big growth ultrasound to make sure that he could fit and everything before they would attempt a breech vaginal birth. But I was just like, I don't even think that's going to be an issue. So as soon as she said, you know, butt is up, head is down, I was like, thank goodness, no breech vaginal birth. I know that there's got to be someone watching this video that has done a breech vaginal birth, and props to you, but that is not something I wanted to, not a road I even wanted to go down. So it was a big sigh of relief, and then she started taking measurements, and then I realized how big this baby was measuring. So when I went in for the ultrasound, I was 36 weeks and 5 days, and the baby was just measuring huge. And I wasn't expecting him to measure small. Obviously, I have big kids because, you know, Chris and I were both big babies. We're both big humans. Hannah was a big kid. I'm not expecting to have a 6-pound baby. But I have like 4 weeks until my due date, and he's measuring like 39, 40 weeks. So that was a little scary. When all was said and done, his head is measuring the 95th percentile, big head. His abdomen is measuring 87th percentile, and his femur length is measuring 85th percentile. So his growth has kind of slowed down when you're looking at the growth curves and stuff. They plotted his measurements over all my ultrasounds, and it's not like he did a big jump up or anything since the last growth ultrasound. If anything, it's kind of calmed down. His growth's calmed down a bit. But still, he's a big kid. I went into my midwife appointment and I, you know, handed her the measurements, and she was like, okay, he is big. They're estimating that right now, at 36 weeks and 5 days, he weighs 8 pounds. And I was like, holy, that is a big kid. That's a big kid. He's already 8 pounds. Like, okay. I was like, but the measurements can be off, right? They can be off by like a pound. And she was like, we say that, but I have to say, you got, you know, your ultrasound was done at one of the best perinatal centers in the state. And they're just not off by that much. And I was like, yeah, I figured. And she took those measurements like 3 times because she was like, he is really big. Let me do that again. She did the measurements, the doctor did the measurements. They were all coming out pretty much the same, measuring 8 pounds kind of on the dot. So I'm just going to go with it and say that they're probably about right. So it is kind of concerning. He had only been head down for like 5-6 days. And so I wasn't expecting him to be like totally engaged and down in there, but she did do a cervical check because we kind of wanted to see what was going on. She said that I was maybe a fingertip dilated. It was getting a little softer, but it was still very high, and he was not engaged at all. He was just floating up there. And she said, you know, sometimes second babies can take longer. They can, you know, it can be later in the pregnancy before they engage. But considering that like Hannah never really engaged properly, it's something that we want to watch. Also, he is a really big kid, so we don't want you going past your due date. And I was like, yeah, sure. She's like, especially in situations like this, the success rates for VBACs peak at 39 weeks. And then they start kind of plummeting down just because the baby's getting too big. And I said, okay. So she suggested that we put in a request for a scheduled C-section just so that we have one on the books. And then it's not set in stone, but I can pick a date and kind of have that as, you know, on my calendar as something that I could take advantage of. And, you know, between now and then, I'm going to be doing weekly appointments. And we can kind of see what the progress is between now and then. So, I walked out of the appointment and I wasn't totally depressed or anything like that. There was definitely a lot of good that happened at this appointment. One, I found out that the baby was head down, healthy, and I got some amazing, amazing 3D pictures of this kid. He is so cute. He's so cute. He's so cute. He has my husband's cute little button nose and these big jowls and big lips and chubby fingers. He was like poking himself in the eye. Just really fabulous 3D pictures. The ultrasound tech did a great job. Again, he's healthy, he's head down, which is everything I wanted. My my Group B strep test came back negative, so I'll take any victory. Seriously, any victory, I'll take it. That's good. I probably will have an IV put in anyways, just because of my blood clotting disorder, just in case they need to do something that we have an IV in place. But I won't have to, you know, be hooked up to antibiotics beforehand, like I would if I was positive for Group B strep. So that's good. I was able to have a cervical check, and I know that some people don't agree with doing that because, you know, just let it go naturally and stuff, but trying to kind of figure out what's going on with my body and whether or not I'm going into labor and if he's engaging, I think it's important for me to do. Definitely make up your own mind if it's something that you want to do. Oh wow, he is moving a lot. And you know, we had this discussion that he is 8 pounds, but at this point I lost 37 pounds when I was at my lowest, and I have since gained back 12 pounds. So I'm still 25 pounds below pre-pregnancy. But the fact that I've only gained 12 pounds, and she was like, that's amazing. That's better than I did with Hannah. And he weighs 8 pounds. She's like, it's not like you are causing this. He's just a big kid. And I was like, well, thank you. Because I think it's hard not to feel like you are to blame. And I'm trying to do everything I can to make sure that this baby is healthy, and that includes, you know, making sure I'm not gaining a lot of weight. And here I'm not gaining a lot of weight, only gained 12 pounds at 37 weeks, and he weighs 8 pounds. And then most importantly, he is full term. He's very, very active. What more can you ask for, really? I just want him to be healthy and happy and cute and adorable and get here safe and sound. And at this point, I'm just mentally preparing myself for a C-section. because I think that's important to be prepared in case you have to have a C-section, that you don't feel like you were a failure or, you know, you didn't do everything you could. With Hannah's, I didn't have postpartum depression, but I definitely had a lot of sadness around her labor and delivery, and I don't want that with this baby. I don't want to go in with any like preconceived notions of how this kid is going to make his entrance into the world. And part of that is being okay with the idea of a C-section for me. Okay, so let's do a belly shot, and you can see the 37-week belly. Okay, so this is the belly at 37 weeks. Here's from the front. I seriously, I was like bulging out when he was transverse. Now that he's head down, it's much better. It's a little, I can still wear my pre-pregnancy jeans, so it's a little bumpy down here. Hold on. There he is. So my placenta is on this side, it's on my right side, along the kind of the back edge of my uterus, so that's good. And but he has been bulging out like right over here all day. Whew. So that's my little boy. Alright, so got a huge list of other videos that I have planned to film over the next week, I guess. Hopefully I can get to all of them now that I'm caught up. And one of them, of course, is my hospital and then Hannah's big sister gift that we're going to give her when she comes to the hospital to meet her little brother. So that is great. If you have any comments or questions, feel free, obviously, to leave them down below in this comment section. And I think that's it. Thanks so much for watching, guys, and I will talk to you later. Bye.